Hey, good morning, Christian. Happy Monday to you. We're going to get a check of weather and traffic coming up in just a few minutes, but we do want to get to one of our top stories this morning, and that is this week. The FDA is holding a meeting about whether to approve the use of Pfizer's vaccine for COVID-19. A lot of people watching this closely. Today, a group of health experts and state and local leaders will be holding a virtual meeting to discuss how the vaccine would be distributed here in the state of Maryland. WMAR 2 News' Megan Knight is live outside of Johns Hopkins Bloomberg School of Public Health, which is hosting that meeting and has more on what we can expect today. Good morning, Megan.
Good morning, Ashley. Yeah, so once the FDA does give the approval to those pharmaceutical companies, there will be a limited amount of vaccines they're going to be rolling out to Maryland and states across the country. So today, health experts from Johns Hopkins, as well as state and local leaders, are going to be holding a virtual panel discussion about how the distribution will run here in Maryland. They plan to talk about the allocation phases of the vaccine, how it's going to be given to people, and also the community's response to receiving the vaccine, which is going to be really critical because there is still a lot of distrust surrounding these vaccines. A panel with the FDA is meeting on Thursday to discuss the emergency authorization use of Pfizer's vaccine. They could have a decision on that within days of the hearing, and then next week they'll meet to talk about Moderna's vaccine. The CDC recommends that frontline healthcare workers and long-term care residents be among the first to receive the vaccination, something the U.S. Secretary of Health and Human Services talked about yesterday on ABC's This Week.
It's going to be progressive, and so we're going to focus on those most vulnerable and those most on the front lines of treating people with COVID with the initial 40 million doses in the next month. And then we're just going to progressively keep adding more and more people. So be thinking in the February-March timeframe that you're going to see more general vaccination, and by the second quarter of next year, we'll have enough vaccine for every American that wants it.
And the CDC is also warning that there might not be enough doses to even give to those designated as top priority. Federal officials estimating about 40 million vaccines will be available if the FDA does approve Moderna and Pfizer's vaccinations. But the catch is that each person needs 2 doses of the vaccination in order for it to work, which means that there could be an even greater shortage than initially anticipated, something that will likely come up in that panel discussion, again happening virtually later this morning. We're live in East Baltimore. Megan Knight, WMAR 2 News.